Hello and welcome. I'm Vincent McCory. This is Africa 54. Tonight, the unforgiving, highly infectious Ebola virus has now claimed more than 1,000 lives in Liberia, Guinea, Sierra Leone and Nigeria. That's according to the World Health Organization. As medical professionals and health workers work tirelessly around the clock to prevent the deadly virus from spreading, a WHO panel of medical ethics experts ruled Tuesday that it is ethical to offer experimental medicine to people infected or at risk. However, the panel also says that use of the experimental Ebola medicines would require informed consent, freedom of choice, confidentiality, respect for the person, preservation of dignity, and involvement of the community. Joining us now with more information on what the hardest hit countries are doing to combat the epidemic is Africa 54 health correspondent Linord Moudou.
Hello, Vincent. Hello, everyone. Liberian Information Minister Lewis Brown says that it will treat 2 infected doctors with the scarce experimental Ebola drug, ZMapp, the first Africans to receive the treatment. Brown says the government has received written consent from the 2 doctors for the treatment, which has not been fully tested in humans. Liberian officials had to receive special approval from the U.S. Food and Drug Administration before any medicine could be exported to Liberia by the drugs manufacturer, California-based MAP Biopharmaceutical. According to a report published by the Wall Street Journal, the company says its supply of the drug has been exhausted after providing doses to a West African nation. Meanwhile, officials in neighboring Ivory Coast have banned air travelers from Liberia, Guinea and Sierra Leone and ordered its flagship carrier, Air Côte d'Ivoire, to cease flights to and from them. The move is the latest signal of fear and rising anxiety toward Ebola. Ivory Coast, the world's top cocoa grower, has not yet registered any cases of the deadly viral disease, but it is seen as vulnerable given its shared borders with Guinea and Liberia. The nation's health minister says the restrictions will stay in place until further notice. And the first European infected by the West Africa Ebola virus has died. Spanish officials say priest Miguel Pajares died in a Madrid hospital where he had been in quarantine since returning from Africa. He was airlifted from Liberia on August 7th after contracting the disease while working for a non-governmental organization. The Spanish health ministry says Pajares was also being treated with the experimental drug ZMapp. 2 U.S. aid workers infected by the disease have shown some signs of improvements since being given the drug. And in an effort to draw more attention to Ebola, some Ghanaians and Nigerians are using social media to teach people ways of protecting themselves against the disease. This is the Idea Hub in Lagos, Nigeria. Here, young IT professionals are housed under one roof, all working on new innovative technology solutions. Today, 27-year-old Babajide Fadoju is using social media to sensitize people on Ebola.
The most important aspect of all viruses, of all problems, has got to do with talking about it, because you need to know what's happening for you to be able to tackle it.
The techies at Idea Hub are among a group of bloggers and activists in Nigeria who have taken it upon themselves to educate people about Ebola through social media platforms. Nigeria has confirmed 10 cases of the disease in Lagos since a man fell sick on arrival from Liberia. 2 people have died. Several dozen people who came into contact with the man are under surveillance. Jafet Omojuwa is a blogger who started the hashtag Facts on Ebola on Twitter.
The people on social media are some of the society's most influential. If they get an issue started, you're likely to have that issue become a national issue. Then they will likely get to reach their parents, their sisters, their cousins, their relatives. They travel. So social media is going to be very, very useful.
The West African Ebola outbreak is the worst in history. The World Health Organization says it represents an international health emergency that will likely continue spreading for months. Over 1,000 people have died during the outbreak and nearly 1,800 have been infected. In Ghana, local radio and television stations are teaching and informing people about Ebola. At City 97.3 FM, Ebola is now a major part of the daily news bulletin.
There was a lot of media attention given to educating the public about HIV/AIDS. You see a lot of TV ads, there were billboards in town, there were radio commercials and the rest. But in the case of Ebola, I don't think the government is doing enough to educate the public about Ebola.
Residents in the capital, Accra, say they are now more aware of how to prevent the infection.
Now make sure I prevent myself enough from as many people as I can, even family members, because you may not know the next touch or contact you make with your next neighbor maybe is the start of your 21 days to your grave. And it is not something that I'm going to wish to have as a fate.
The bloggers and activists in both Ghana and Nigeria hope their message will reach as many people as possible, not just in their countries, but across the continent, helping to curb the spread of one of the world's most deadly diseases. That's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot, Linord. Now, be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.